Thanks, CONNECTpreneur, for having us back. I'm Zack Molnar. I'm the finance head at Caring Closures, or CCI for short. And we're utilizing our platform locking technology to modernize access control, which is one of the most successful public health interventions in history to debate several current public health epidemics. These are really being driven by ease of access to medication and supplements that are driving several deadly and costly public health crises. Sneaking pills from family medicine cabinets is the #1 source for teen drug misuse, with over 700,000 teens initiating drug abuse each year from pilfering, and 90% of abusers start in their teen years, and you have a 70% chance of developing a substance use disorder if you start in your teen years versus after age 17. So early intervention is critical to combating this epidemic. Additionally, a child visits the ER every 8 minutes from a drug or supplement poisoning, which is a 13% increase over the last 2 years. And overall, these issues cost our economy tens of billions of dollars annually. And the underlying cause of these epidemics is that our existing access control measures, child-resistant caps and closures, are over 50 years old and no longer adequate for the dangers of the substances they intend to protect. But our locking prescription vials, or LPVs, offer a solution, vastly increasing levels of medication security beyond existing access control measures and abating these issues. So our first product in market is a 4-ring locking vial that has 10,000 potential combinations, providing a barrier to keep controlled substances out of the wrong hands. So these are things such as opioids or ADHD medications. Then we have a 2-ring vial that has 100 potential combinations, more than sufficient to keep a small child from accessing the contents, making it ideal for substances that pose significant child mortality risk, such as hormonal medications or statins. And overall, these products encompass a $5 billion market opportunity, as there are 550 million controlled substance prescriptions each year and over 1 billion pediatric fatality medication prescriptions. So LPVs are designed to be used in pharmacy medication dispensing, where pharmacists would fill prescriptions directly into our vials, and the vial code would be code chosen by the patient at the point of dispensing. We're currently pursuing reimbursement from health insurance companies, where payers reimburse pharmacies to dispense medications into our vials, which will be added onto the pharmacy's total reimbursement amount for filling the prescription. So no real change in their processes at all. And the economics to benefits to these stakeholders are really significant. Insurance companies would generate a 390% ROI, and that's generated by the savings related to drug misuse and overdose and avoiding extra hospital usage and addiction treatment. And the expected reimbursement rates to pharmacies will provide a greater than 50% gross margin to them. And as an example of the scale of this benefit for a pharmacy, this would be a $600 million revenue opportunity for CVS for controlled substances alone. So we're turning a cost, which is the current orange vial, into a revenue opportunity. And our vials have already been proven to be effective. In our initial trial results, they showed a 100% reduction in missing medication, where 39% of patients reported medication missing from the regular bottle, and 0% of patients reported medication missing after using our locking vial. In fact, this is driving Ohio to adopt coverage for MAT Medicaid patients starting later this year. So already proving out this and generating business from it. And then we also have additional clinical trials underway, the most important of which is with the Centers for Medicaid or Medicaid Services, or CMS, providing a direct line into Medicare, who's the large market leader in healthcare with over 30% of the market. And our product is really the only one that can be operated within this large-scale dispensing space, as we're 10 times cheaper to make and 6 times easier to use. So we'll be the product of choice for payers, given our low cost, and for pharmacies, given our ease of workflow use. And these advantages are all protected by our IP portfolio of 13 issued and pending patents. And we have the right team in place to execute on this. Milton, our CEO, has had several successful businesses as exits as a CEO. And we have the payer and pharmacy perspectives on our board who agree this is the right path forward. And we have a strong mission-aligned team where everyone has some sort of connection to the opioid epidemic and has a strong personal mission to do what they can to stop it all. We'll generate about $540,000 in revenue this year, and we'll expect to be break even in 2025. Expect to exit in 2028 at about a $600+ million valuation. And we're well ahead of our key inflection points, given we're getting MAT coverage this year and controlled substance coverage starting next year in a couple other states. We do have an open bridge round right now. We have $1 million remaining of the $3 million authorized. We've raised about $2 million. We'll be raising the cap after the next million as we expect to upsize. And then we're in discussions for a larger round later this year with several larger families. We have a dual offering between a note and a safe, and you can see the terms here. Happy to discuss more in the breakout room. But appreciate everyone listening and look forward to seeing everyone in the breakout room. Thanks so much for the time.